Hello dear colleagues, today we will briefly discuss about the MRI appearances of the cranial nerves. This is the heavily T2-weighted sequence, which is also called CISS sequence, which stands for Constructive Interface in Steady State. This sequence is also called FIESTA, which stands for Fast Imaging Employing Steady State Acquisition. This is the most sensitive sequence to look for cranial nerves. We will briefly discuss one by one. So, this is the region of olfactory groove, and here we can see this black structure is olfactory bulb. This is right olfactory bulb and this is left olfactory bulb, which is surrounded by the CSF sleeve. These olfactory bulbs are just below the gyrus rectus. This is the gyrus rectus. Olfactory bulbs are the only parts which we can see on MRI. Rest of the nerve is not visualized. The second nerve is optic nerve. Here we can see the first part of the optic nerve, which is within the globe, is called intraocular part. After that, this part is called intraorbital part, and then this enters into the optic canal, which is called intracanalicular part. After that, it becomes intracranial and combines to form the optic chiasma. The optic chiasma further divide into optic tracts. These are the optic tract. This is right optic tract and this is the left optic tract. The third cranial nerve is oculomotor nerve. At the level of interpedunculaire cistern, here we can see it is arising from the midbrain and traveling anteriorly into the cavernous sinus, and it further travels into the superior orbital fissure and then into the orbital cavity. The only part which is visualized on MRI is the interpeduncular cisternal segment and somewhat the cavernous part of the oculomotor nerve. So here we can see it is arising and extending into the cavernous sinus. This is the part of the cavernous sinus. The fourth cranial nerve is the trochlear nerve. At the level of midbrain, this structure is medullary velum, and anterior to the medullary velum, the nucleus of the trochlear nerve is present. The nerve arises posteriorly and decussates and travels toward the contralateral side. So here we can see this is the trochlear nerve and it is traveling anteriorly along the free edge of the tentorium cerebelli. It is traveling anteriorly to enter into the cavernous sinus and then through the superior orbital fissure into the orbital cavity to supply superior oblique muscle. The fifth cranial nerve is trigeminal nerve. It arises from the pons. This is the P-pontine cistern, and this segment of the trigeminal nerve is called cisternal segment. It travels anteriorly to enter through the porus trigeminus into the Meckel's cave, and here it forms the Gazerian ganglion and further divides into the three parts. The first part is called ophthalmic division, which enters into the cavernous sinus and then through the superior orbital fissure enters into the orbital cavity. The second division is maxillary division, which enters into the foramen rotundum. This is the region of the foramen rotundum to enter into the pterygopalatine fossa. The third division is the mandibular division. The mandibular division do not enters into the cavernous sinus, and through the Meckel's cave it enters into the foramen ovale. This is the region of the foramen ovale. and through this it travels outside of the cranium. The sixth cranial nerve is the abducens nerve. It arises from the medulla and travels into the medullary cistern and then enters into the canal which is called Dorello's canal. So this is the course of abducens nerve, and here it is entering into the Dorello's canal. After that it enters into the cavernous sinus and then into the orbital cavity to supply the lateral rectus muscle. The only part which is visualized on the MRI is its cisternal segment and a bit into the Dorello's canal. The seventh cranial nerve is facial nerve. Here we can see this is the course of the facial nerve and it enters into the internal auditory canal and then further enters into the tympanic bone, which we can't see on MRI. The facial nerve lies anterior and superior aspect of the vestibulocochlear nerve. The eighth nerve is vestibulocochlear nerve. This is the course of the eighth cranial nerve, and then it enters into the internal auditory canal where it divides into the three divisions. So this is the relationship of the facial nerve with the vestibulocochlear nerve into the internal auditory canal. Here we can see this is the facial nerve which is present along the anterior and superior aspect of the internal auditory canal. Just below it is the cochlear division of the vestibulocochlear nerve, and posteriorly is the superior division of the vestibular nerve and inferior division of the vestibular nerve. The ninth cranial nerve is glossopharyngeal nerve, and it arises from the lateral medulla. This is the glossopharyngeal nerve. Here we can see it is present in the lateral medullary cistern, which is called cisternal segment, and it enters into the jugular foramen, and we can't see its further course on MRI. The 10th cranial nerve is vagus nerve, which is just below the glossopharyngeal nerve, and it travels the same course like glossopharyngeal nerve and enters into the jugular foramen. The 11th cranial nerve is accessory nerve, and we can't see much part of the accessory nerve on MRI. Only few fibers of the spinal portion of accessory nerve are seen within the spinal canal at the level of jugular foramen. And finally, the 12th cranial nerve is hypoglossal nerve. It arises from the medulla and enters into the hypoglossal canal to supply the tongue. Thank you.